This is a case of a 65-year-old female with long-standing RA who is brought in by her family, who noted her inability to use her hands for the first few hours of the morning, and that she could only get dressed or brush her teeth after she had immersed her hands in warm water for 30 minutes in order for her to be able to do those activities. On physical exam, the patient had multiple tender and swollen joints and had evidence of chronic inflammation of her wrists and of her knuckles, which had increased since her previous exam. When her clinician asked her how she was doing, she said, "I'm doing really well. Ever since you started me on those medications, I feel much, much better." While her family, who was there in the exam room, were saying that she was doing very poorly and could hardly walk. The clinician showed this woman her vector test result, which was 63, indicating high molecular disease activity, and explained to her that despite her feeling okay and feeling that she was doing fine, she could in fact do a lot better if she had changed and increased her medication because of her active disease activity. And after consultation with the patient and her family, the physician and the patient agreed that a biologic drug would be added so that this uncontrolled disease activity could be controlled, and that the patient could avoid having long-term joint damage and long-term disability due to the uncontrolled inflammation. This is an example of a Stoic patient who, despite evidence that there is active disease, denies that she is doing poorly because she wants to please her physician.